Hello everyone, my name is Osama Mosalem. I'm a second year internal medicine resident at Michigan State University. It's my pleasure today to present our case of severe epistaxis second to Dabrafenib and Tramatinib use in non-small cell lung cancer. So first of all, BRAF mutations are estimated to be present in 2 to 4% of the cases of non-small cell lung cancer. In 2018, the FDA approved the new combination medication Dabrafenib, which is a BRAF inhibitor, and Tramatinib, which is a MEK inhibitor, in the treatment of metastatic non-small cell lung cancer that has BRAF V600E mutation. Despite the clinical benefits of this combination of this new targeted therapy, the use of this combined targeted therapy has been associated with some side effects. Some of them are serious and life-threatening. So our case here is a 77-year-old male with a recent diagnosis of lung adenocarcinoma, metastatic to the brain and the small bowel. Genomic analysis showed BRAF V600E mutation, and he was started on dual therapy with Dabrafenib and Tramatinib. Patient presented with profound epistaxis over the last 6 hours. He reported that over the last 4 days has been having intermittent epistaxis, however, it has been non-stop for the last 6 hours. When he came to the ED, he was having profuse bleeding from his ears and the gums. And due to inability to protect his airways, he was intubated. Meanwhile, the bleeding was controlled with nasal packing and nebulized tranexamic acid. Laboratory workup showed normal coagulation profile, normal platelets, and there was no evidence of thrombocytopenia. Our patient hasn't been on blood thinners. After 24 hours of intubation, and after the epistaxis has been controlled with balloon pack, he was extubated. Shortly after extubation, he started coughing large amount of dark clotted blood. He developed a stridor, and we had to re-intubate him emergently. A video-assisted laryngoscopy was done after intubation, and you can see in figure number 1 that it showed a large clot-like mass occluding the vocal cords, and that's the black arrow. A flexible bronchoscopy was done emergently to try to remove this clot. And as you can see in figure number 2, we removed a huge clot that measured up to 12 inches from his airways. This clot was extending from the oropharynx down into the distal trachea. After the clot removal, there was no evidence of acute bleeding, and as you can see in figure number 3, the airways were clear and there was no evidence of active bleeding. Based on the patient wishes, there was a discussion about goals of care with the patient and his family, and they decided to pursue with comfort care measures. So Dabrafenib and Tramatinib we recently approved 2018 by the FDA for treatment of untreated patients with BRAF V600E mutations with metastatic non-small cell lung cancer. Despite the clinical benefits and the improvement in progression-free and overall survival, these medications have been described to cause a wide range of side effects. The most common side effects which has been reported are fever, pyrexia, nausea, and respiratory distress. Bleeding has been reported as a rare but life-threatening side effect. And if we took a look at the initial clinical trial, the BRF 113928, 3.2% of the subjects developed grade 3 or grade 4 hemorrhage. This was described as hemorrhage, either bleeding from the nose, epistaxis, intracranial hemorrhage, GI hemorrhage. There were different types of hemorrhage described. And there has been a few case reports that have described intracranial hemorrhage and hepatic hemorrhage second to the combination of these medications. The pathology behind this hemorrhage remains unclear, especially with the rarity of the case, how rare the cases are. However, it has been postulated that hemorrhage can be related to tumor necrosis and rapid tumor response. So finally, Dabrafenib and Tramatinib are generally well tolerated in the management of metastatic non-small cell lung cancer, and they are usually associated with improvement in the overall survival and the progression-free survival. However, A wide range of these side effects can occur to this targeted therapy. One of them is bleeding, which is rare but also life-threatening, and it can happen due to rapid tumor necrosis. Our case aims to raise the awareness of the physicians to these side effects. Thank you.